Welcome to OET Answers.
Your preparation time is over. Now, you can start your speaking role play. Don't worry if I stop you when the time is up.
Good afternoon, Patricia. I'm Naso Andrew. How can I assist you today?
Hi, Naso Andrew. I've been in contact with someone who tested positive for COVID-19, and honestly, I'm feeling quite anxious about it. I've developed a runny nose, and I can't help but worry that it might be a sign of the virus.
I completely understand why you're feeling this way, Patricia. It's entirely normal to feel uneasy after being exposed to someone with COVID-19, especially with everything we've learned about the virus. But you did the right thing by coming in to get checked. We're here to help you through this. Before we proceed, can you please confirm your full name and age for our records?
Sure. My full name is Patricia, and I'm 32 years old.
Thank you, Patricia. It's great that you're being proactive about your health. Let's dive into your symptoms a bit more. You mentioned you have a runny nose. Are there any other symptoms you've noticed, like a cough, sore throat, or perhaps a fever?
Thankfully, it's just the runny nose. No cough, no fever, nothing else. But I can't help worrying about what could happen if it's COVID-19, especially with all the serious complications that could arise.
It's good that you're paying attention to your health, Patricia. Staying alert to any changes is important, but try not to let anxiety get the best of you. A runny nose could be caused by a variety of things, such as seasonal allergies, a common cold, or even just the change in weather. Even if it turns out to be a mild case of COVID-19, most people in your age group, who are generally healthy, experience only mild symptoms and recover fully without serious complications. The risk of severe illness is lower, and if any symptoms do worsen, there are effective treatments available to help manage them. I hope that brings you some comfort.
That's somewhat reassuring, Naso Andrew. It's just hard not to worry, you know? But what can I do to help myself feel better in the meantime? Are there specific treatments I should consider?
Absolutely, Patricia. The first step we should take is to perform a COVID-19 test today. We can do a rapid test right here in the clinic, and you'll have your results back quickly. If your runny nose is bothering you, you can take over-the-counter medications like acetaminophen or ibuprofen to help ease any discomfort. It's also important to stay hydrated by drinking plenty of fluids. Water, herbal teas, and broths are great options. Adding foods rich in vitamin C, such as oranges, kiwis, and bell peppers, to your diet can help support your immune system. Getting enough rest is also crucial. Try to prioritize sleep and allow your body the time it needs to heal. Does that sound manageable for you?
Yes, that sounds pretty straightforward. I'll make sure to follow those steps. But I'm also really concerned about the possibility of spreading anything to others. What should I do to minimize that risk?
That's a very important concern, Patricia, and I'm glad you brought it up. The best way to protect others right now is to limit your interactions as much as possible. Try to stay home and avoid going out unless it's absolutely necessary. When you do need to be around other people, make sure you're covering your mouth and nose with a mask, especially when you cough or sneeze. Frequent hand washing is also key. Wash your hands thoroughly with soap and water for at least 20 seconds, or use hand sanitizer if soap and water aren't available. Additionally, regularly disinfecting surfaces in your home, like doorknobs, light switches, and countertops can help reduce the spread of any germs. These precautions will go a long way in keeping those around you safe. Does that make sense?
Yes, it does. I think I've got a good handle on that. But what if I do need medical attention? Should I see a doctor for treatment now?
I'm glad you're thinking ahead, Patricia. At this point, if your symptoms remain mild, there's no need to see a doctor immediately. Most cases of COVID-19 can be managed at home with the measures we've discussed. However, it's important to know the warning signs that indicate you should seek medical help. If you start to develop a high fever, experience difficulty breathing, or if you notice that your symptoms are getting worse instead of better, those are clear signals that it's time to contact a healthcare provider. If you ever feel uncertain about your symptoms, it's always better to err on the side of caution and reach out to us. We're here to support you every step of the way. Anything else on your mind?
No, I think that covers everything. I really appreciate your help and guidance, Naso Andrew.
You're very welcome, Patricia. It's our priority to ensure you feel supported and informed. Now let's go ahead and perform the rapid COVID-19 test, shall we?
Yes, please. Let's do it.
Great, we'll get that done right away. Thank you for coming in today, Patricia, and remember, if you have any other questions or concerns, we're just a call away.
Thank you, Naso Andrew. I feel much better after talking with you.
I'm really glad to hear that, Patricia. You're taking all the right steps. Stay safe, take care of yourself, and don't hesitate to reach out if you need us. We're here for you.
Thanks again, Naso Andrew. Take care. That is the end of your speaking role play. All the best.
Thank you.
Thank you for watching. Please like and subscribe for more videos like this. Kindly comment your suggestions and help us to do better.